Okay, great. Thanks a lot for having me along to chat today. I'm going to just chat real briefly about a research project that we're trying to get off the ground at the moment. So just to start, I'll introduce myself. I'm a qualitative researcher based at Glasgow Caledonian University. I've been working around addiction for a few years now, mostly working with the homeless community in Glasgow. So I've done some work around HIV, and then most recently I've been doing work at the heroin assisted treatment service in Glasgow. So the project that we're trying to get up and running at the moment is going to be an evaluation of the peer-to-peer naloxone training and supply in Scotland. So it's a collaboration between Glasgow Caledonian University, Stirling University, and SDF, and we're planning to run it between August of this year, and it's going to go on for about a year. So I'm going to just tell you a little bit about what we're wanting to do, and hopefully what the project will contribute. We've heard a lot today from a lot of people who are working at the coalface and doing the real work, and I think the project's really about trying to put all that learning down in a formal way. So I'll just explain a little bit what the plan is. So we've got two stages in the project. The first stage is we're going to be trying to collect data from the NHS about how many kits are being handed out, who's taking the kits, where that's happening. And then the second stage, we're going to be interviewing people that were involved in the peer-to-peer naloxone program. So we're going to speak to 4 of the facilitators, the people who are running the program, 10 peer workers who are distributing naloxone, and hopefully 10 people who have received naloxone through the program. Really what the project's trying to do is understand what the impact of the program has been, and that's for individuals and communities, and to use that to kind of develop good practice. So we want to know how many people have been through the program, and really the key bit is what were their experiences, what were the sort of strengths of the program, what were the challenges, what are the kind of key barriers and facilitators to enabling peer-to-peer naloxone, and also now what are the kind of complications with COVID-19, and how does that mean that the programs might have to change? How do we adapt to that? So that's kind of the gist of the research. I'm a qualitative researcher, so what I'm really interested in is stories and people's perspectives, and this is a really important part for me for this project. Yeah, we're going to look at some numbers as well of people, number of people who've been through the programs and how many kits have been distributed and things. But what I'm really interested in is people's experiences. So we want to get really kind of rich stories about what's happened, not just a kind of yes no question or a questionnaire with a box. The researcher is going to take the lead of the people who are in the interviews, and we want to figure out what's important to them and their perspectives. There's been a whole bunch of interesting stuff today already, and there's lots of stuff bouncing around in my head. So people were talking about identity and how being involved in peer-to-peer distribution of naloxone can change people's identities. I think George was talking about that. People not just being a drug user, but this developing self-esteem and self-worth. And really that's the kind of the stuff we want to really get at, the benefits of this for people involved, and why it works to reach people. I think from what we've heard, everybody, this knowledge is already there. You guys know why peer-to-peer naloxone works so well, but what we're trying to do is just put that in a format that we can take to then policymakers and the Scottish government and things to really promote this. So just make it kind of into this formal way, and you get it all down paper and things, and then organizations like SDF hopefully will be able to use the reports that we write to promote the peer-to-peer naloxone and get it up and running more around the country. I think unfortunately policymakers respond better to that kind of formal setup. So that's basically what the project's going to do, is take all this knowledge that's already exists and put it in a sort of formal way, so that we can have those conversations. I've just taken some notes whilst people were talking about stuff that I think is really interesting, and just to give you an example of the stuff we're going to try and make sure goes into this project, and we can spread the word about. George talked about a really interesting thing about in the programs in his work. It's peers who make the decisions, and it's peers who police the program. I thought that was really interesting. Peter talked about the offer and accepted rate having a huge jump with peer-to-peer distribution. So we try and figure out why is there a big jump there, and put that in a formal way that policy makers will listen to. Malky talked about the barriers that being kind of rolled out more widely, so it'd be really interesting to get perspective on that from peers as well, and what they think about why there can be resistance sometimes. Malky also talked about COVID-19, meaning a lot of the barriers have come down, and how do we keep those barriers down, and kind of getting rid of all the sort of bureaucracy and red tape that stops us doing these programs. So I think that'll be really interesting to try and get that all down formally as well. And Jim said something about the possibility of kind of getting shopkeepers trained up for naloxone. So that's something else that we'll try and look at, is getting people who've been involved in these projects, like figuring out what do they think the next step should be, what's the progression, what do we do next. So really it's just we're going to come in and just try and capture all this information, and I see the project as giving that kind of formal voice to people that are involved in these peer-to-peer programs, just to promote them in a way that policymakers and government will have to pay attention to, basically. So just the last thing to add is, it was just really quickly to give you an overview. We're waiting this week to find out if we've got funding for this project from the Drugs Death Task Force. Hopefully we'll find out this week. I'll be staring at my email, pressing F5 lots. But even if we don't get funding from the Drugs Death Task Force, we'll be pushing with other funders to get money to do this, because I think, as we've all heard today, it's such a vital thing to be doing, and really can make a huge difference to the drug-related deaths. So that's all I've got to say today. I'm really happy to answer any questions and things, and I think I'll probably be chatting to lots of people that are in this meeting over the coming months, just really to capture all this learning and insight that we've all got. So yeah.